Thank you. Welcome to our workshop, Microbiome, what it is and why it's important to your health. My name is Michael Riato, and I will be your moderator for this workshop. It is my absolute pleasure to introduce today's speaker, Dr. Urvi Shah. Dr. Shah is an assistant attending physician on the myeloma service at Memorial Sloan Kettering Cancer Center and assistant professor of medicine at Weill Cornell Medicine. Her research studies the effect of modifiable risk factors such as nutrition, obesity, and diabetes on cancer development and progression, and how dietary interventions and supplements influence insulin resistance, body composition, gut biome, and the immune system. Please join me in welcoming Dr. Urvi Shah.
Thank you so much, Michael, for that introduction, and I'm really glad to be here with you all, and thank you for joining in. I'm excited to talk about this topic, which I think is an up-and-coming topic because there's a lot of research going into this field, and I think we're learning a lot, and we'll see a lot in the years to come as well, as we're just scratching the surface. In terms of the microbiome, I'll first explain to you what that is as well, and then we'll go into some studies that have shown changes in the microbiome, as well as looking at how nutrition tips that could affect the microbiome. These are my disclosures. So with this interest of mine to look at nutrition, we've developed a program studying nutrition, microbiome, and metabolism in myeloma and also other cancers at Memorial Sloan Kettering. We know now that patients with blood cancers are living longer than maybe a decade ago. For instance, in myeloma and lymphoma, even leukemia, there have been significant progresses made in terms of the number of treatment options available. And with that, the good news is that patients now have an opportunity to live longer, but it should not just be living longer, but we should also focus on outcomes that improve quality of life so we're living better. And how do we look at dietary and lifestyle interventions to help or aid the treatment and help respond better? So just to bring home that point and understand why this is important, this is an example or a case of a 66-year-old patient that I had seen a few years ago who had multiple comorbidities and multiple medical issues. And because of these issues, I was not able to do many of the treatments that mattered, such as stem cell transplantation and CAR T-cell therapy and clinical trials. And because of this, the patient had a decreased overall survival. What I've highlighted in green are things that I think could have been avoided or improved or reduced with lifestyle changes over time. I know it's challenging when someone develops cancer and trying to focus on that, but we're just going to discuss and think about some small tips and small changes we can do. Another case of a patient of mine a few years ago who had myeloma. Compared to the prior patient, this patient is overall pretty healthy, but still has cardiovascular disease. And what you can see in this case is that the patient responded to chemotherapy, went on maintenance therapy, was like, from the time he came in, he was in a wheelchair, now doing really well, walking around, felt like he had gotten back to his life. However, he did develop a cardiac arrest and die of that while the myeloma was in remission. So what I'm trying to say is that our therapies have gotten so good sometimes, not for all patients, but for some patients, that the patients are living very long, which is a great thing. But then we have to deal with the other lifestyle or comorbidity issues that could affect outcomes. So cardiovascular disease, diabetes, nutrition, things like that, physical activity, strength, things like that. So some of the things I'll talk about is a microbiome, different dietary patterns, some trials that we've done and others have done, as well as some nutrition tips. So one question for you all, and maybe you already know this, but do we have more human or bacterial cells in our body? And we would assume it's human cells, but actually that's not the case, and we're more bacterial cells than human cells. It's 38 trillion compared to 30 trillion. And so I think it's just makes sense that we should be thinking about what does the bacteria that live inside of us want to eat, not just what we want to eat. And so thinking about the microbiome, there's a lot been done in healthy individuals and in disease. And what you do see is that with gut dysbiosis or unhealthy microbiome, there are things like reduced diversity and reduction in the healthy bacteria or good bacteria. This leads to the mucus layer and a problem with the barrier that's between their intestine and the immune system, and there's more inflammation and more dysfunction. What you can see here is also another figure from a paper showing how the microbiome is central to health and disease, and we're just scratching the surface, but a lot of different things that could affect it. So what are factors that influence the microbiome? And there are things that, are non-modifiable, meaning we're born with or we live in a certain way. There's nothing we can do about it. And how old we are, whether we are male or female, what is our race, genetics, infections, some of those things, medical, some disorders that, we can't control. But what we can control are things that also affect the microbiome and immune system, such as nutrition, our body composition, diabetes, physical activity, sleep, stress, drugs, and medication. So I'll focus on the top 3 in this list, but I think we can talk about the others as well. So one concept I want you all to understand is what is microbiome diversity. And the reason I bring this up is one of the things is that diversity is the most commonly talked about in most papers and studies. So if you understand what diversity means, I think you'll understand a lot of the studies around microbiome and what they're trying to say, and you see a pattern of what we are seeing similarly from these studies. So think about a healthy forest, which has many varieties, like a rainforest of flora, fauna, animals, plants, species, so many different kinds, big and small. That is a healthy ecosystem. Think about a plantation where there are only banana trees or only coconut trees for miles on end, and that is not a diverse or healthy ecosystem compared to the rainforest. So when we think about diversity, we're thinking about a healthy rainforest in the gut microbiome where we want many kinds of species and we want more of the variety. And there have been numerous studies looking at this diversity and correlating it with cancer outcomes. So microbiome diversity has been associated with survival in many studies. What you can see here on the left is the red line is high diversity, have a better progression-free survival after transplant compared to low diversity. And then on the right, you see a box plot where the patients who had higher diversity were more likely to be in complete remission from their myeloma or sustained MRD negative. The figure on the left was from patients with lymphoma, myeloma as well. So how do we improve gut microbiome diversity, and is that possible? Now, not a lot of studies have been done in cancer patients, and a lot of this data that I will show you is in healthy individuals and some in cancer patients, but I think a lot needs to be done. And dietary patterns are a modifiable factor that can affect the gut microbiome, and probably one of the most important ones as well. So one study looked at many hundreds of patients and asked them to fill out a dietary survey and said, how many plant foods do you eat in a week? And what they meant by is different plant foods. So if you're eating broccoli 10 times a week, that counts as 1. But if you eat broccoli, potato, green beans, oranges, and apples, that will count as 5 or 6. So how many different plant foods do you eat in a week? I would encourage you all to maybe go back and count this for yourselves and think about it. Are you eating the same things because you just like it and in your comfort zone? Or are you really trying different things? And maybe in a same meal you have a stew with many types of beans, then that would count as many instead of 1. Every type of bean would be different. So what they showed in the study was that those that ate more than 30 plant foods per week had more microbiome diversity, less antibiotic resistance genes in the bacteria, and more polyunsaturated fatty acids with anti-cancer and fat-reducing properties. So this study suggests, again, it's not an interventional study where we gave patients food and looked at what happened, but we look at large populations and see what is associated. And we do see that patients who eat 30-plus variety of plant foods seem to have better microbiome health. This is another study in healthy populations. Now, this is an interventional study. So what they did is they took 18 participants and asked them, let's increase your fiber intake or increase the consumption of fiber in your diet. So they added 20 grams per day of dietary fiber for 4 weeks. And what you can see is the microbiome function, like short-chain fatty acids, improved. I didn't really talk about short-chain fatty acids yet, but short-chain fatty acids are things that are made or metabolites that are made by these bacteria. So short-chain fatty acids like butyrate, acetate, propionate have been shown to have healthy effects on the immune system and sometimes potentially anti-cancer and anti-inflammatory effects too. So they did see an improvement in microbiome function. And then they did another part of the study was to have these patients eat 6 servings per day of fermented foods over their baseline. And they did show that there was a reduction in inflammation and increased microbiome diversity. Again, suggesting high fiber and maybe fermented foods in healthy individuals did affect the microbiome in a good way. What about the immune system? So I showed you how dietary patterns affect the immune system in healthy individuals. And there have been actually 3 studies that have looked at dietary patterns and COVID-19 severity. And since I know it's not as relevant as it was before, but I think still relevant for us in terms of thinking about infections. And I'm showing you only one of the studies. There are a few others that show very similar findings. But what they showed was that patients who had improved diet quality, meaning following more of plant-forward, meaning fiber-rich diet, actually had lower odds of moderate to severe COVID by 73%, suggesting that this anti-inflammatory property may have an effect. Now, again, these are population studies, not intervening, so we have to understand that there are some limitations to these data, but at least if 3 studies are showing the same thing, I think we have to think about it and not ignore it. So I encourage you all to think about how much fiber you get in your diet. And if it's possible, sometimes I know it's not easy to suddenly go from a very low fiber diet to a very high fiber diet because the microbiome needs to adjust. But if you can count and maybe look at how much fiber you're getting in your diet, remember fiber only comes from plant foods. And so if you're eating enough plant sources, you will get fiber. Beans, seeds, nuts, grains, fruits, vegetables all have fiber. So this was a study. They surveyed the U.S. population, and they asked them, do you get enough fiber in your diet? And 67% of them said, yes, I get enough fiber. But then when they actually checked, only 5% did. So we really live in a situation where most people are fiber deficient and are not getting enough fiber. So I encourage you, that's why, to think about, are you getting enough in your diet? And like we talked about, a fiber-rich diet, it has major implications on the microbiome and the gut lining as well as the immune system through multiple studies. So also, patients and doctors often think like, okay, the patient has cancer, they've gone through a lot, are they really going to make dietary changes? Should we bother with even telling them about this? And I agree that it may not be at the right time all the time. If you've gone through a really intense period of treatment, now's not the time to suddenly try to change everything because maybe you're just about recovering from those symptoms. But making gradual and slow changes can be helpful. So what you can see here, we surveyed over 400 patients with plasma cell disorders, meaning myeloma and the precancer states of myeloma. And what you see is most of these patients had questions about nutrition. Most felt their oncologist did not address it. And if their oncologist gave them recommendations, the patients did attempt to follow it. What was most interesting to me was also that patients actually made changes on their own. Of course, this is what they reported to us in the survey, but you can see that they started eating more of the healthier foods and reduced the unhealthy foods. At least that's what they reported. So patients are making changes whether the doctor tells them or not. And I think these conversations, like the one we're having today, are extremely important to talk about what the changes could be and how do we think about making them. Another good website that if you haven't heard of is the American Institute of Cancer Research, or the World Cancer Research Fund. And what you can see here are they have 10 cancer prevention guidelines, and out of them, 6 out of those 10 are actually related to diet and nutrition. And they also have a section on their website on foods that fight cancer and foods to limit. And if you look at the section on foods that fight cancer, you will see that all of those foods are fiber-rich plant foods. And foods to limit include sugary, processed drinks, and meat. And so this is, again, something that you could go to any time and look at it. What do we know about pre-diagnosis dietary patterns and cancer? Now, again, these are population studies, not saying that it's for everybody or this is why each person got cancer or not, because there can be vegans and vegetarians and plant-based eaters also who get cancer, and it could be the other way. Somebody is eating a really unhealthy diet and doesn't get cancer. But what these studies try to tell us is what increases our risk for cancer and what reduces our risk. And there was one study from the UK, one from USA, and one from France, showing that people who ate more fiber-rich foods, plant-forward foods, however you look at the data, seem to have about a 15 to 20% reduced risk of cancer overall. So as cancer patients and survivors, I think it's important for us to also think about future risk. And so I think this somewhat applies to us as well. And so I'm showing you some mechanisms on how diet may affect it. So the fiber in the intestine actually moves the food or the contents in the intestine faster through it. So that reduced time of contact is actually beneficial in reducing, especially for colon cancer, but also it's thought to be potentially beneficial for other cancers. And then butyrate is a short-chain fatty acid. So like I said, the fiber leads to healthier bacteria that make these short-chain fatty acids and reduce inflammation. And then we also have flavonoids or phytochemicals, which have anti-cancer, anti-inflammatory effects. And then also fiber is very good at maintaining weight in terms of keeping us within the normal body weight and also reducing insulin resistance. So how about looking at some studies that have been done where diet was looked at in combination with standard treatment or alone in prevention, so before a cancer develops or to prevent the next cancer from developing, and in the treatment setting in combination with therapies, and then in the survivorship setting after we finish the chemotherapy and now in the maintenance or in the remission setting. And there is an opportunity for secondary prevention, you know, in the prevention setting where we have these pre-cancer states, both in myeloma, lymphoma, leukemia, and there are genetic alterations that progress over time, telling us that as the disease progresses, there's more genetic changes in the cancer. But there's also a change in the immune function, that the immune function gets more and more impaired with time. And so one of the studies that we did recently was looking at, can we help tilt the scale for myeloma development by if we can help patients reduce inflammation, have a better diet, improve insulin resistance, can we tilt the scale for myeloma development in patients who have the pre-cancer state of MGUS or smoldering myeloma for myeloma? And so in this trial, we had patients who had a BMI or body mass index over 25, so in the category of overweight or obese, and also had the diagnosis of MGUS or monoclonal gammopathy or smoldering myeloma, which are the precancerous states. We gave them 3 months of a plant-based diet, which is a high-fiber diet. We gave them 6 months of coaching, and we followed them for 1 year on the study. Overall, the patients actually, most of them were able to follow it and continue. Only 3 patients dropped out, 2 for medical reasons unrelated to the study, and 1 patient felt like they could not continue the diet. But the rest, 20 patients, were able to do this. What we did see was that patients' adherence to the dietary pattern, where we calculated how much of their diet is unprocessed plant food intake, improved from a baseline of 20% before they went on the study to 90%, and it was improved even a year after. We also saw that patients had an improvement in their weight by about 8 to 9% reduction. We saw their quality of life improve. Even though we were having them make lifestyle changes, it actually helped them have a better quality of life, less fatigue, and less shortness of breath rather than the opposite. We also surveyed the patients and asked them, did you have any improvement in any other symptoms of yours? And you can see here in green are the bars for patients who had improvement in things like cholesterol, hypertension, diabetes, energy, joint pains, and even GI symptoms. All patients said they were able to do this, and most said that even if this was to be done again, they would be happy to do it again. And what was nice was we had 4 patients who were able to actually stop prescription medications because they no longer needed it, such as insulin for one patient who was on insulin for diabetes for over 30 years before going on the study, and then in a few months of being on the study was able to stop insulin. So that also leads to savings in terms of money when you don't have to take those many prescriptions. And then what we also looked at is, are we able to bring down the insulin levels and the adiponectin-leptin ratio or insulin resistance levels, improve them? So we did see an improvement in insulin levels and an improvement in insulin sensitivity. And we do know that these things have been associated or linked to cancer progression in different studies. So being able to improve that potentially could have a benefit, and that's what we were trying to look at. We also looked at the gut microbiome, and remember we talked about how diversity is a good thing. We were able to show in this study that after they changed their dietary pattern towards this more high-fiber, plant-forward dietary pattern, they were actually able to improve the gut microbiome diversity. And you can see from the blue bar to the green bar, this has improved over time. There was also a reduction in inflammation. So the C-reactive protein, for those that had it elevated, that level did come down. 2 patients on the study had their cancer markers or the precancer state were rising. So the blue line shows you before they went on the study. And then the red line shows you after they went on the study, where there was a slowing in progression of their precancer state to cancer, suggesting that maybe this intervention with improving weight, improving insulin resistance, improving the microbiome as well as the immune system. I didn't show you the data on the immune system, but we saw improvements in that too, could have maybe affected the trajectory of the cancer for these patients. And this is with patient permission, but this was one of our patients on the study before the study, and then after the study, he felt like this really helped him. And he's in his 70s at this time and still feels very much like this helped him live a better life. We are now enrolling a much bigger study for precancer patients to try to understand even the effect not just of diet, but also supplements such as omega-3 and curcumin. And the next part I wanted to talk about was what about when patients are on treatment? Can lifestyle and dietary changes really make a difference or not? And unfortunately, there is not a lot of data in this, and I'll just show you a few small studies that have been done. So this is one study done in acute lymphoblastic leukemia. What they did is they asked 40 patients who were newly diagnosed to improve their diet quality to follow the USDA My Plate guidelines and traffic light, meaning eating healthier foods and reducing unhealthy foods. And then they compared for these patients, was there a change in their disease before and after compared to a historical control or a group that never made these changes. And you can see, of course, that insulin resistance improved. So that's what you see in this figure. But you can see here when they compared the rate of complete remission between the patients who followed this on study compared to historical control, they did see an improvement in remission rate. Another study that was done in patients post-transplant or patients undergoing transplant was this Neutro Diet study. And I think this study is interesting and important because oftentimes patients who go through transplant are told not to eat fresh fruit and vegetables because of the infection risk. But this study shows you why that's not necessary. It was a phase 3 randomized, like a large study. They had 222 patients. They randomized them, meaning half of them got a protective diet where foods were cooked and they could only eat cooked foods and food that had thick peel that they would peel. And the other half got a diet which was basically hospital hygiene standards, but they could eat a salad if it was made and washed and prepared well, or they could eat fresh fruit that doesn't have a thick skin. What you can see is the infection risk was the same between the two. The number of infections was no different. The weight change in the patients that actually had a protective diet, there was more reduction in weight compared to those that were able to eat the fresh fruits and vegetables. And quality of life also may have been a little bit different between these groups and slightly more negative impact with the restrictive diet, suggesting that I think it's important for us not to restrict the healthy fresh fruits and vegetables, but just make sure we're using caution in terms of not eating it outside where we think it's unhygienic or things like that, but trying to be as mindful about these things. What about in the survivorship setting? So can dietary interventions help with that? And could it really prolong the time in remission for patients? And so we had looked at this study, Dr. Lisokin and myself, as a group at MSK, and what we showed was that patients on maintenance therapy, lenalidomide maintenance, who we looked at their microbiome. So this is they got myeloma treatment, then they got a transplant or no transplant, and then they were on maintenance therapy. So after their initial cancer treatment, now on maintenance treatment. And we collected microbiome, so stool samples, and we collected dietary information. And you can see that in the teal bar, that's the patients who had complete remission. They were more likely to have higher stool diversity and healthier bacteria and higher levels of the short-chain fatty acids I talked about. And then we surveyed these patients too and asked them, like, what is it that you're eating? And we did see a correlation between healthier sources of protein, such as plant protein and seafood protein, as well as dietary flavonoids, which are plant chemicals, like I told you, with anti-cancer, anti-inflammatory effects, were linked to these these markers such as butyrate and sustained MRD negativity. So what we think is that diet may be affecting the microbiome, which I've shown you in multiple studies, and through that affects potentially long-term control of the cancer. And we are now trying to study this in a study of maintenance where a certain number of patients are getting the diet as well while they're in maintenance. So it's an interventional study. Another point I wanted to make was also in terms of looking at comorbidities like diabetes or body mass index. There have been studies in lymphoma, leukemia, myeloma, looking at both for obesity as well as diabetes, showing that having an elevated BMI has been associated probably with a slightly worse survival compared to a normal BMI, as well as with diabetes. So I think it's important to think about these factors as something we can work towards or possible to be in our control. So now you might ask, and I wanted to shift gears a little bit to a few tips on how do we think about fiber and how do we think about adding some of these recommendations in small ways. It doesn't have to be everything all at once. Remember, I told you that fiber intake requirement is about 30 grams on average, 25 for females, and it depends on what age group you fall in, but you can look that up online. But look at a Western diet and look at a high fiber diet. In general, Western diets have very little fiber content, and this is just an example, not saying this is a perfect meal either side, but I'm just saying to you and showing you an example of how, where does fiber come from. And you can see that the Western diet is only getting the fiber from that bag of broccoli and the potato and the white rice and the bread, but none of the other foods have fiber. Whereas the high fiber diet is getting enough from all foods. Then you might ask, what about their protein? Because maybe they're not getting enough protein if they're eating so much fiber. But one thing to remember is that the recommended daily intake is 0.8 grams per kilo. I think if a person is older or if a person has more requirements because they've just gone through cancer treatment or they're losing weight, then maybe a little higher protein intake, 1.2 grams per kilo. So if we think about a person who's 60 kilos and we use that exact same example of the same foods, you can see that even the high fiber diet is meeting the protein requirements of 72 grams, because even oatmeal has protein, and so does brown rice, and so do lentils and avocados. So most foods have all three building blocks, and it's important to understand when we balance this out, we get enough. You need to plan out any meal, but here is what you see as an example. So I just want to say, of course, we need to individualize it. And since I'm giving a talk to everybody, I cannot guide individual patients, but I think you should think about what is your disease stage. Is this something you feel receptive to hearing about and empowered by, or this feels very overwhelming and you don't want to hear about it and it's not you don't feel it's going to help you. Also, whether there are medical issues, if do you have diarrhea or nausea or other things which you can only tolerate certain foods and you just cannot eat the other foods, then you have to focus on what you can eat, because that's also important, because we don't want significant weight loss unnecessarily. But also thinking about, do you have any of these other things like diabetes, cardiovascular disease, cholesterol? How do we reverse these things? There's enough data that lifestyle and dietary changes could improve those outcomes. And also, people are different. Some like to make changes overnight and some like to do it gradually. So know what's good for you, but it's better not to overwhelm yourself and make all the changes at once if you're not the kind of person who likes that. So some practical tips to consider incorporating is 3 servings of whole grains. Mainly, remember, carbohydrates are not bad, because a lot of people assume carbohydrates means sugar. When it's complex carbohydrates like whole grains, they're actually healthy and associated with reduced cancer risk. What we don't want is the sugary drinks and the refined carbs, such as cakes and cookies. Of course, we all enjoy them once in a way, but we don't want that to be a regular part of our meals. Fiber should be about at least 25 to 30 grams, and foods that the diversity of food, the fruit and vegetable servings of 5 to 6, and prioritizing plant sources of protein such as beans, tofu, tempeh. If there's one thing you want to make a change, and if you have the average intake of fiber that the U.S. population does, which is about 10 grams, and you want to increase this to 25 grams, if you just add 1 cup of beans to your diet every day, you will go from 10 grams to 25 grams, because 1 cup of beans has 15 grams protein. and 15 grams fiber. So it's possible to make just a small change like that and improve diet quality. And then we want to prioritize unsaturated fats as well. It's important not to be calorie counting unless you feel that that's beneficial. But if people are trying to lose weight with just calorie counting, sometimes that is very restrictive. And I think just prioritizing the healthy foods and foods that are lower in calories, such as fruits, vegetables, and fiber-rich foods, can help with that. And if you need to gain weight because of that, prioritizing healthy fats such as nuts and seeds, avocados, olive oil, and healthy proteins such as beans and tofu can also help. And then even frozen fruits and vegetables are healthy. It doesn't have to be raw salads all the time. This is a good example. I just wanted to bring home the point, like, okay, you might think I'm eating honey toasted pecans. That's healthy. It's not. But look at the food labels if you can to understand. And you can see here that this has about 19 grams of carbohydrates, not a problem. But the problem is that the fiber is only 1 gram and all of it is sugars and 18 grams of added sugars. And when you think about sugars, about 4 grams of sugar is 1 teaspoon. And the average American takes in 17 teaspoons of sugar per day. That's the average. So there are many people who are way above that 17. I encourage you to go and think about how many teaspoons you get per day. But this serving, 1 serving of these pecans, which is 18 grams here, is about 4.5 teaspoons of sugar already. So that's something that I would encourage you to keep the teaspoons to maybe less than 9 or 10 teaspoons per day if possible. And a lot of sugar is in hidden things like cereal and things like that which you wouldn't know about. So eating healthy doesn't have to be boring. It doesn't have to impair quality of life or affect it. And often it could be things that can be cooked, and it doesn't have to be raw fruits and vegetables and salads alone. It could be exactly the same thing you like to eat, just a healthier version of it. Like if you like a hamburger, maybe substituting for a black bean burger. Or if you like a curry with meat in it, maybe thinking next time, could it be the same curry with tofu in it? So small changes like that can go a long way. And here are some goals I just put in case this has inspired you to make some changes, and maybe you could think about one of these that you could start with and think about the one that could be something that is feasible for you. I know each patient and person is different. And with that, I just like to conclude that it's important to focus in cancer from not just living longer, but to living better and longer. And by incorporating fitness, nutrition, and improving all our overall health, we could also improve our quality of life. And I just wanted to thank the patients who've taken part in these studies we are doing, my mentors, collaborators, and also funding sources, without which this wouldn't be possible. If you wanted more information about the work I do post a little bit on social media, and you can follow through Urvi Shah, MD. Happy to answer any questions that come up.
All right. Thank you, Dr. Shah, for that incredible presentation. Much appreciated. We'll now begin the question and answer session. If you have a question for Dr. Shah, please use the chat box on the left side of your screen to submit your question. We'll answer as many questions as possible. We are going to extend the session just a little bit because we started a little bit late, so we should have plenty of time. The first question, Dr. Shah, is kind of a combination question because it's come up multiple times in the chat box. And basically it talks about medications. And it says that if I'm on chronic medications like acid reflux, metformin, or antibiotics, right, what does that do to my microbiome, and how can I improve it or help it?
Really good question, and it is a challenge because, as you can see, each study is complicated and takes years to do. So if we had to do one study with each medication, it would be hard to do all of them and know exactly what happens. But I can tell you, in overall, for things like antibiotics, there has been a study done in mouse models last year. It was published in Nature Communications, and what they showed was that fiber supplementation protects from antibiotic-induced gut microbiome dysbiosis in mice. Now, that's different than humans, but if they are already able to see this, and we already saw in healthy individuals and also in cancer, those that have better diversity of the microbiome and healthier microbiome have better outcomes. I think maybe with antibiotics, it may be a little harder to achieve that level of compared to without, but it's not all in waste that just because you're on antibiotics, you shouldn't even try. I think it's important to make these changes, maybe even more so important, but I think it's a good area that we need to study much better. In terms of other medications, I have even less data, and I think with antibiotics also there's data that some antibiotics affect the microbiome more than others, and we're just getting to know a little bit of this. So if your doctor thinks you need antibiotics, I think I wouldn't just say stop it. I would say continue to do that, but think about some of these dietary changes such as fiber-rich foods, fermented foods, things like that in your diet.
All right. Thank you, Dr. Shah. Next question. If I have frequent bouts of diverticulitis, right, how can I be able to eat more fiber like corn or nuts, which aggravate it?
Good question. And what I have understood from the GI data is that was a myth previously, that patients with diverticulitis should not eat nuts or seeds because it would get lodged in the diverticulosis. But this is no longer something that they recommend anymore. However, if that is really the case, and I think it's still possible to make sure that it's ground or chewed properly so that it's not a piece that's there. But the point was that it was thought that these small nuts and seeds could lodge into the diverticuli and cause more inflammation, but that has not been proven to be true. So I would actually encourage you to eat more fiber. Another reason is the reason diverticulosis develops for many patients, maybe not all, but there is some data that a diet for long term, many years and decades without enough fiber leads to periods of constipation, and this high pressure from the constipation leads to these outpouchings and diverticulosis formation. So a fiber-rich diet actually reduces diverticulosis risk.
All right. Thank you, Dr. Shah. Next question. I have chronic GVHD. Would a high fiber or plant-based diet help reduce the inflammation?
Great question. I actually realized that, I couldn't include these slides in the talk because of time, but there is a study, and you might want to look at this, but it was a paper published in Blood from some of my colleagues in 2020, and this study looked at the microbiome, microbe-derived short-chain fatty acids, butyrate and propionate, and showed that they are associated with protection from chronic GVHD. So they didn't look at diet in this, they only looked at these short-chain fatty acids and said, do people who have higher levels of these fatty acids have protection from GVHD? And what they did show is that, yes, more of these good short-chain fatty acids means protection or less GVHD. What we do know from the studies I already showed you is that eating a diet which is rich in fiber leads to more of these short-chain fatty acids. And when there are more of these short-chain fatty acids, maybe there is a potential that this could affect chronic GVHD. Nobody's yet ever studied it by providing a diet like that and seeing if we could improve GVHD. But based on the information we have from different studies, I believe that it could potentially help patients. And also through the immune system. So these short-chain fatty acids affect the immune system in a positive way, which could affect the GVHD in a positive way.
All right. Next question. What is a good source of information on different beneficial probiotics and prebiotics? Where can I find help?
It's a good question. Unfortunately, I don't know of a good source. What I will say is that I don't generally recommend that people take a probiotic or after transplant or any time in general. couple reasons. One is that there are small case reports or few case reports of patients taking a probiotic and then getting a bloodstream infection because of a strain from the probiotic. And I think that risk is higher in somebody post-transplant who has immune compromise. Second reason would be is that there was a study done in pancreatic cancer, in melanoma, so this is different. This is not myeloma, this is skin cancer. These patients were getting an immune therapy called a checkpoint inhibitor, and they looked at what was their diet like in terms of how much fiber were they taking in. And they showed that patients who had high fiber diet had the longest time in remission or best progression-free survival compared to those who had a low fiber diet or a diet high in fiber with taking probiotics. So the probiotics actually seem to be detrimental in that study instead of being beneficial. And I think that that may be because probiotics cannot have the number and variety of strains that we need and we'll have a few. So maybe we need to study this better and understand it. And we are doing a study through the Health Tree Foundation looking at the effect of probiotics on the gut microbiome in smoldering myeloma patients to see if this improves diversity and how patients do. So I would say that post-antibiotics, if you need it for a short term to improve symptoms, or if beneficial directly you're having benefits, then I think it's okay to take for a while. But I wouldn't recommend it to everybody and all the time just because we think it's healthy.
All right, thank you. Next question. You mentioned the American Cancer Society. Are there any other resources that you would recommend for nutritional guidance?
So American Cancer Society is great. I didn't actually mention that one. I mentioned the American Institute of Cancer Research. So you can look up the American Institute of Cancer Research. You can look at the American Cancer Society. In terms of herbs and supplements, MSK or Memorial Sloan Kettering has an app and a website called About Herbs. And you can, if you put in a herb or supplement you're thinking of taking, it will give you information on drug interactions and things like that. So, and also potential uses or side effects. So I think that that's a good source for understanding some of that. And then I do post a little bit about this kind of education and information on Instagram, Twitter, or social media as well. So I think those would be some sources.
Okay. What are fermented foods exactly? And can you expand on why fermented foods are helpful to you?
Sure. So fermented foods are things like sauerkraut, kombucha, kimchi, yogurt, any food that has been cultured or fermented overnight or for a long period of time develops increase in these bacteria that kind of improve the quality of that food. And with that, mostly these bacteria also lies in the food, and so when we eat these foods, we get some of the these bacteria into our gut that have anti-inflammatory effects. So you can see a reduction in inflammation.
Okay, thank you. This one's an interesting one, especially from myself. Does physical fitness and daily exercise improve your gut biome and improve digestion and your uptake of nutrients?
I love that question because I actually came across a study just last week looking at this. And what that study was, again, it's not an interventional study, but what they looked at is thousands of people, and they looked at their diet and their lifestyle, and other factors, and then they associated it with microbiome diversity. And they showed that increased all of these dietary things that I already talked about, but they also showed that increased physical activity was associated with increased diversity. So I think it helps. And I think if possible, depending on what part of your cancer treatment you're in, I would strongly recommend doing some of it, even if it's just a walk for 15 minutes a day, or just doing, even if you're not able to get out of bed, but just moving within bed or things like that. So maybe small goals that we can set for ourselves, and each person is different, so we have to decide on a day-to-day basis what's possible. But I think that these things help.
Okay, thank you. Next question. How can we eat a plant-based diet when so many of us are protein and calorie deficient because we're grossly underweight? How much fat is healthy, etc.? Can you comment about that?
Great question. And when I talk about a couple of things, one is when I talk about a plant-based diet, I think every person needs to decide what that percentage looks like for themselves. So what I'm trying to say is it's important to get majority of your calories, or at least the 30 grams of fiber in your diet. But if you feel like you're not able to do that fully, and there is certain amounts of non-plant-based foods you're going to eat, that I think is okay, but it's just a matter of like the percentage. So I think that sometimes people will think like when I'm talking about plant-based, I'm saying everybody needs to be vegan and vegetarian. But remember, diet quality is more important than these labels we give it. So if somebody can be vegan or vegetarian and eat Oreo cookies and French fries, which are plant-based, and that is not healthy, and that could be a junk food eater, and then that's not a healthy diet. Whereas somebody could be omnivore, where they're eating meat a little bit, but they're mostly getting enough fiber from their diet, and that's probably healthier. So I think that a vegan diet can be extremely healthy if it is done right or planned well, but it all depends on how you're thinking about it. So I think it's important to make the changes gradually. That's one thing. And the second thing is, plant-based diets, because they are high in fiber, they tend to be lower in calorie density, meaning for the same amount of food you eat, you might be getting a little less calories unless you're eating things like nuts, seeds, and cooked foods. So if you eat a cup of spinach in a salad, you're really not getting much because it takes time to chew and it's not a lot. But if you really cook that spinach, you will probably eat 3 cups of spinach without knowing it, because once you cook the spinach, it becomes much easier to eat. Same thing with smoothies. So if your goal is to gain weight, thinking about how do we get more calories in, it's all a matter of just how can we eat more. So things like what you can do is make smoothies, which are healthy with a lot of fruits, vegetables, nuts, seeds, things like that. You could eat a lot more cooked foods than salads, because you'll automatically eat more calories that way. You could be eating more frequently in terms of every few hours. That way you're getting enough calories. And when you're snacking, think about things like nuts, which are again rich in calories. So yes, in general, if you look at the same foods, plant foods have a little less calories than animal foods, which is why patients or people will stay more likely to be within a normal weight if they're eating more plant foods. But I think if the opposite is where you're worried about losing weight, try to ensure you're getting enough calories. A big mistake people make when they suddenly go plant-based is they're not used to eating that much, so they just eat the same amount in terms of quantity, and then they're losing weight. But if you want to gain weight, you probably just need to eat more in terms of quantity, because plant foods, like I said, are lower in calories, so you need to eat much more. And thinking about beans are a great source of, so maybe eating bowls of things that are cooked with things like that.
All right. Thank you, Dr. Shah. Next question is, how can I improve chronic anemia or low iron with my diet without eating red meat? Can you offer some suggestions on what types of food that I can do that?
Sure. So there are 2 types of iron. There is heme iron and non-heme iron. Heme iron comes from animal food. So what we have in our blood is also heme iron. What beef, pork, all of that will have is heme iron, even chicken. When you what plants have is non-heme iron, but that is still good source of iron. There are some data to say that actually the non-heme iron is less inflammatory than the heme iron. So it may be a better source of iron in some ways. It may be a little harder to absorb in terms of quantity, but when you do get that iron, it is a less inflammatory kind of iron. Foods that are rich in iron that are plant-based are leafy greens, beans, things like that. So even if you just Google plant-based sources of iron or plant-based diet iron sources, you will find foods that are rich in that, and then you can think about adding them daily or regularly into your diet. Unfortunately, I think that also when we have something like a blood cancer, there is also the possibility sometimes that the hemoglobin is low, and it may not be due to an iron deficiency, but a lot of people assume that because they have anemia, they have iron deficiency, and that may not be the case, and the anemia may be from the chemotherapy or the actual blood cancer or from another deficiency. And so I think that just because somebody has anemia doesn't mean that they need to eat red meat or they need iron. So I think it's important first to get your levels checked. And if it is really that low, and then it may be worth just taking an iron supplement to get the levels up and then trying to maintain it with eating healthy foods that are rich in iron. If it is not low, then you have more time and you could just eat iron-rich foods like I talked about.
Okay, here's a kind of combination question. On your chart where you did the Western versus the high-fiber diet chart, and if you're post-chemo and transplant and you have bone density issues, can the chart be modified to include more calcium intake, and or do you recommend calcium supplements?
It's a great question, and it's one that actually has gotten a lot of recent attention. The challenge with a calcium supplement is we assume, okay, bones have calcium, so if we eat more calcium, we're going to have stronger bones, and this has been drilled into all of our heads, and even mine, from the time we're young, and assumed. But there's a very good paper in the New England Journal of Medicine by Walter Willett, who's a top nutritional scientist, and the title is Milk and Health. And if you look at that paper and the evidence around calcium supplementation and bone health, there isn't data to actually show that calcium supplements improve bone density. So I'm not saying that, and there is some data also that calcium supplements may increase cardiovascular disease because they deposit into the blood vessels. So I would not recommend very high doses of calcium supplements. If you do take a supplement, it should be something about 500 or less per time that you take it. So if you're taking 1,000 or 1,500 grams, divided into doses, not just one dose of 1,500, because otherwise you're going to have this deposition issue. And in terms of bone health, like I said, that there is no data showing that actually increasing calcium supplements was associated with greater bone density. What I think is also very important to remember is that bone health comes from improved diet quality, so eating good sources of protein, like healthier sources, including the calcium, the vitamin D, vitamin K, like all of these things together, and it's not just one thing. And also physical activity and resistance training is very important for bone health. Another thing is calcium is not going to be absorbed if you don't have enough vitamin D. So even if you're going to take calcium supplements, but your vitamin D levels are extremely low, there's no point in taking it. So I think it's important to make sure that your vitamin D levels are within the normal range, maybe somewhere between 20 or 30 to 50, so that you can absorb the calcium that you're taking in your diet, and if you end up on a supplement too.
Okay, Dr. Shah, one last question. How can I get enough high fiber when I have chronic diarrhea from my lenalidomide and other chemotherapy treatments?
That's a good question, and I think the gut adjusts over time. So I think that one is for lenalidomide-induced diarrhea, there is some thought that maybe high fatty foods actually worsen the diarrhea. So high fiber foods are generally not fatty foods, and they might actually help with the diarrhea, not worsen it. Now we are studying this to understand the effects in our study, and hopefully I'll have more data for you in a few years. But I think that if you can make slow changes where I don't know how many grams of fiber you're eating now, but suppose it's 5 or 10, then maybe you add a small amount, like maybe a quarter cup of beans a day, or maybe you add one fruit per day or something, and see how your gut handles it. Because also our microbiome needs to change to be able to digest these new foods that we're eating and get used to it. So we need to do it gradually and slowly and see if that can help you handle it. And that could be one way.
Okay, we are almost out of time. On behalf of BMT InfoNet and our partners, I'd like to thank Dr. Shah for her very helpful presentation. And thank you, the audience, for your excellent questions. A short reminder that there's another workshop on microbiome and GVHD this coming Thursday on the symposium. So you may please contact BMT InfoNet if we can help you in any other way. Enjoy the rest of the symposium and have a great afternoon and evening. Thank you very much.